Hi, I'm Darshni Anandan. Today I would like to talk about Weil's diseases. In the majority of cases, leptospirosis causes a mild illness, but in some people, a more severe form of leptospirosis occurs. This more severe form is commonly referred to as Weil's disease, so called after Dr. Adolf Weils, who first described it. Weil's disease is caused by leptospira bacteria. Weil's disease is a form of bacterial infection, also known as leptospirosis, that is carried by animals, most commonly in rat and cattle. It can be caught by humans through contact with rat or cattle urine, most commonly occurring through contaminated fresh water. Infection of human usually occurs where open wounds are immersed in relatively stagnant water contaminated with rat or cattle urine. It can be contracted from contact with any fresh or untreated water, including ponds, lakes, rivers, as well as flood waters that are contaminated. Those most at risk of infection are open water swimmers who expose their whole body to possible infection. Activities that occur in or near fresh water, such as fishing, water skiing, sailing, and kayaking, also present a risk. The bacteria are unable to survive in salt water, so there is no risk of infection of Weil's disease from swimming in the sea. Pathogenesis. Leptospira are present in water bodies. It enters through breaks in the skin, through cuts and abrasions. It could enter through mouth, nose, and eyes too. Rarely enters through ingestion. Incubation period around 1 to 2 weeks. When multiplies, bloodstream produce fever. May establish organ and involvement in kidney and liver. May produce hemorrhage and necrosis in the tissue and initiates dysfunction of these organs.
Thank you to Mr. that she explained about the Weil disease, introduction of the Weil disease, pathogenesis, and diagnosis of it. Alright, now I want to explain about the treatment, prevention, and population about Weil's disease. Let me share my screen first. Let us see about the treatment. Treatment for Weil's disease is very important, where appropriate chemotherapy and supportive therapy help reduce the mortality of severe cases. Early treatment is very important because it may progress in severity if not treated in 3 days. Antibiotic is the main treatment for Weil disease, where it should be given to patient as soon as possible as 50 before the 50 of the illness. The benefit of antibiotic after the patient take treatment of the 50 is very controversial. Dioxazine is given for shorter illness by 2 days penicillin. Use is severe electrophoresis, shortened duration of fever, improved renal function, quicker and shortened hospital stay, and more shedding of the electricity in the urine. However, severe cases of electrophoresis, high doses penicillin is given for the infected person. Less severe cases, as repeated for the Weil's disease patient, is given by oral antibiotics such as amoxicillin, ampicillin, deoxycycline, erythromycin, and azithromycin. I have been read a case study from the late of 1970 of the US soldiers in Panama where 200 mg per week given to prevented the process main causes of Weil disease. A randomized placebo-controlled study of the efficacy of deoxynivalenol 200 grams per week in the abdomen explained there are no effective efficacy among indigenous population in terms of acquiring leptospiral infection, but significantly effect is reducing clinical illness and mortality. But there is difficulties to recommend to people with continuous ongoing exposure. However, they need to retrospherosis vaccine to prevent the disease in the high risk of emphasis. And steroid is given for severe analysis. The benefit of methylperiodicilline in pulmonary electrophoresis. And then steroid outcome by reducing mortality is given within 12 hours of manifestation of pulmonary manifestation like RDS prone ventilation improved oxidization in Wales disease. Case study patient with severe hypoxemia from diffuse or alveolar hemorrhage caused by vascularity of positive ankle. Uh, Proven ventilation improved oxidation by 70%, and there is an improved VQ matching by changes in inflation, ventilation, requirement, and position of alveolar, where it removes secretion and blood. The supine blood drain posterior blocking dependent airway and cause hypoventilation. It has been it's a true story from the unity of the um, British Journal of Anesthesia 2004, where they cause hypoventilation of the dorsal lungs. For severe cases, reports after diagnosed laboratory, the plasma exchange should be considered as an adjunct therapy for patients with severe ischemic electrophoresis, severe of bilirubemia, complication of ARF, who are not sure rapid clinical response to controversial treatment such as antibiotics and hemodiaphragm. Where the reported treatment of the Wills disease such as antibiotic, prophylaxis, steroid, ventilation, and plasma exchange. Now we are going to see how to prevent the Wills disease among our community. Okay, the prevention should be targeted at the infection source, the route of transmission between the infection source and human host, where how can we reduce the infection source, the route of transmission between the infection source and the human host, fraud and proper treatment of the infection, surveillance, vaccination should be given, and we have to communicate well to prevent the risk and give more awareness for collaboration. Okay, where I can explain about it, where reduce rodent population using rodicide and mechanical trapping in biological by using rodent-proof material to cover food storage. Schedules and proper garbage disposal to eliminate food for rodent in surrounding human habitat. Unbird, trained to deliver rodent of shelter, food and meat. Maintain environmental sanitization such as housing area and parks and regularly cleaning. Food premises inspection and rating for closure of unhygienic eat spaces by covering ready-to-eat food, proper disposal of leftover food. Avoid contact with population communicated such communicated water such as water of rain, the for ablution and washing. Apply waterproof plasters for wounds before and covering water. Avoid unnecessary contact with flood water. Wear rubber boots, glove, and high risk occupation. Prohibit using or exposure of contaminated water bodies until risk assessment has been conducted. There can we can control measures have to reopen. We can control by reopening of affected area only by carried after reassessment as mentioned and the risk has been shown below. We can advise people also to be more exposed to possible contaminated water source, either through occupation, recreational activities to wash themselves with clean water and seek immediate medical treatment if they have been such as they think they have been invaded for the West disease, they can reassessment to can be more aware of the illness. Prevention measure must be given by knowledge, by data verified for the registration e-notification, investigation to identify the probable source of infection, to take environmental sample whenever it is appropriate for evidence such as water, rodent, soil, and many more. We can get more get prophylaxis for people with short term of exposure, such as soldiers conducting jungle operations like that. We can get create awareness about the disease and its prevention of health staff and public and recreation park operations such as various media, because we are using most of the various medias right now. And then we can form an integration or collaboration such as with local authorized, such as Wildlife Department, Department of Veterinary Services, JLKN to maintain cleanliness in the respective environment settings, especially rodent control. And finally, we came to the conclusion. There is electrocitosis is an important re-emerging zoonosis because of interface between human and animal environment. Awareness and control and protection measure early detection and prompt treatment of the keys to reduce the mortality and mobility risk of leptospirosis. Way forward through the scope of the One Health approach of collaboration and continuous core collectability between clinical must be aware awareness of leptospirosis, non-specific clinic presentation, and difficult laboratory diagnosis. Consider leptospirosis as a different diagnosis for any undifferentiated febrile illness. Early detection leads to early treatment with antibiotic, steroid, and other supportive measures, including respiratory support. So we can give awareness control to the people to be more aware, and we can approach One Health organization to give more like presentation or to make more aware of to the patients, to the public, and we can explain how we can control the disease. It can't be do it one person in the jungle, but we can detect early for the symptoms of the Wales disease, and we can prevent the disease with collaboration of all. And that's all for me. This is my reference. And thank you so much. Thank you for listening.